What if I told you that the blood pressure number your doctor has been pushing you toward for years could actually be making you sicker? What if that little pill you swallow every single morning, the one that's supposed to protect your heart, is actually causing you to feel dizzy, exhausted, and confused? Sounds unbelievable, right? But here's the thing. A major medical study involving over 9,000 adults proved that the blood pressure target most doctors give to seniors over 60 may be doing more harm than good. And yet, millions of seniors across America are still being told to chase a number that was never designed for their age group. Today, I'm going to reveal the real blood pressure number that seniors over 60 should actually be targeting. I'm going to explain why your doctor may have gotten this wrong, and most importantly, I'm going to show you what you can do right now to protect your heart, your brain, and your life. Stay with me until the end of this video, because the number one most dangerous mistake is something almost every senior makes, and nobody warns them about it. Let's get into it. Now, before we dive in, let me ask you a simple question. Do you know what your blood pressure reading was the last time you visited your doctor? If you're like most people over 60, you probably heard your doctor say something like, "We need to get that number down." Or maybe they said 120 over 80. That's our goal, 120 over 80. You've heard that number your whole life, haven't you? It's been drilled into our heads for decades. It's on posters in every doctor's office. It's in every magazine article about heart health. 120 over 80, the golden standard, the magic number. But here's what nobody tells you. That number, 120 over 80, was established based on studies that primarily focused on younger and middle-aged adults. People in their 30s, 40s, and 50s, not people in their 60s, 70s, and 80s. And that distinction, that one small detail that most doctors gloss over, could be the difference between living a healthy, active, independent life or ending up in a hospital bed wondering what went wrong. So let's break this down, step by step. No complicated medical jargon, no confusing charts. Just the plain, honest truth that every single person over 60 deserves to know. First, let's make sure we're all on the same page about what blood pressure actually is, because I've talked to hundreds of seniors who take blood pressure medication every single day but can't actually explain what those two numbers mean. And that's not their fault. Doctors are busy, appointments are short, nobody takes the time to really explain things anymore. So here it is, plain and simple. When your heart beats, it pumps blood through your arteries. That blood pushes against the walls of those arteries. The force of that push, that's your blood pressure. Now, the two numbers you see on that little monitor. The top number is called systolic pressure. Think of it as the pressure when your heart is actively squeezing and pushing blood out. The bottom number is called diastolic pressure. That's the pressure when your heart is resting between beats. It's relaxing, taking a tiny break before the next squeeze. So when someone says your blood pressure is 130 over 85, that means your heart is pushing with a force of 130 when it beats and 85 when it rests. Simple enough, right? Now here's where it gets interesting. As you age, your arteries naturally become a little stiffer, a little less flexible. Think of it like a garden hose that's been sitting in the sun for 20 years. It's still functional, it still carries water, but it doesn't bend and flex the way it used to. That's exactly what happens inside your body. And because your arteries are stiffer, your heart has to push a little harder to move blood through them, which means your systolic number, that top number, naturally goes up as you age. This is a normal part of aging. Let me say that again because it's incredibly important. A slightly higher systolic blood pressure in a 70-year-old is a normal part of aging. It does not automatically mean something is wrong. It does not automatically mean you need more medication. But guess what most doctors do when they see that number creeping up? They reach for the prescription pad. Now, I want to be very clear here. I am not saying blood pressure doesn't matter. It absolutely does. Uncontrolled high blood pressure is one of the leading causes of stroke, heart attack, kidney failure, and dementia. This is serious stuff. But here's the problem. For decades, the medical community treated blood pressure like a one-size-fits-all situation. Young or old, male or female, healthy or frail. Everyone got the same target, 120 over 80. But think about that for a moment. Does it really make sense that a 35-year-old marathon runner and an 82-year-old grandmother with arthritis should have the exact same blood pressure goal? Of course not. And the medical community is finally starting to admit this. You see, in 2015, a landmark study called the SPRINT trial made headlines around the world. It stands for Systolic Pressure Intervention Trial, and it involved over 9,400 adults with high blood pressure. The study basically divided people into two groups. One group was given medications to bring their systolic blood pressure below 120. The other group targeted below below 140. And the results? They were complicated. Yes, the group targeting below 120 had fewer heart attacks and strokes. That part made all the headlines. Doctors everywhere started pushing for more aggressive blood pressure targets. But here's what the headlines didn't tell you. The group targeting below 120 also experienced significantly more side effects, more dizziness, more fainting episodes, more kidney problems, more dangerous drops in blood pressure that led to falls. Now, if you're 35 years old and you get a little dizzy, you grab the counter and steady yourself. No big deal. But if you're 78 years old and you get dizzy, you fall, you break a hip, you end up in surgery, you spend weeks in a hospital bed, you develop an infection, you lose your independence. Do you see where I'm going with this? For many seniors, the treatment became more dangerous than the disease. And that, my friends, is the truth that has been hiding in plain sight for years. So what is the right blood pressure number for seniors over 60? Let's look at what the actual medical guidelines say. Not what your neighbor told you, not what you read on Facebook, the real evidence-based guidelines. The American College of Cardiology and the American Heart Association updated their guidelines, and here's what they recommend. For most adults, including older adults, the target systolic blood pressure should be less than 130, not 120, 130. That's a significant difference. But wait, it gets even more nuanced than that. The American Academy of Family Physicians and the American College of Physicians actually issued a separate guideline specifically for adults over 60, and their recommendation for healthy adults over 60, a systolic target of less than 150 is reasonable. Yes, you heard me correctly, 150. Now, for seniors who have additional risk factors, like a history of stroke or heart disease, they recommend a lower target around 140. But here's the key takeaway. There is no universal agreement in the medical community that every single person over 60 needs to be at 120 over 80. In fact, many geriatric specialists, the doctors who specialize in caring for older adults, argue that pushing blood pressure too low in seniors is one of the most common and dangerous medical mistakes being made today. Let me ask you something. Has your doctor ever sat down with you and explained all of this? Have they ever discussed the risks of overtreating your blood pressure? Have they ever asked you about dizziness, fatigue, or brain fog that might be caused by your medication? If the answer is no, you're not alone. And that's exactly why this video matters. Now, I want to pause right here for just a moment. If you're over 60, or if you're caring for an elderly parent, spouse, or loved one, this information could genuinely be life-saving. I'm not exaggerating when I say that. Every single year, hundreds of thousands of seniors end up in emergency rooms because of medication side effects, and blood pressure drugs are among the top culprits. So if this video is helping you understand something your doctor never took the time to explain, I need you to do two things for me. First, hit that subscribe button right now. I release videos like this every single week, designed specifically for seniors and their families. And second, share this video with someone you love. Send it to your spouse, text it to your children, post it in your church group, because chances are someone you care about is dealing with this exact problem right now.
All right, let's keep going, because we're about to get into the most important part. Let me tell you about something that happens far more often than most people realize. Imagine a 74-year-old woman named Margaret. She's relatively healthy. She walks every morning. She plays with her grandchildren on weekends. She lives independently. Margaret goes to her doctor for a routine checkup. Her blood pressure reads 142 over 88. Her doctor frowns, reaches for the prescription pad, and adds a second blood pressure medication to her daily routine. "We need to get that number down, Margaret." Margaret trusts her doctor. She starts taking the new pill. Within 2 weeks, she starts feeling tired all the time. She doesn't have the energy to walk in the mornings anymore. She feels lightheaded when she stands up from the couch. One evening, she gets up to use the bathroom at night and the room spins. She grabs for the wall but misses. She falls. She fractures her wrist and bruises her hip. Her daughter rushes her to the hospital. The emergency room doctor runs some tests and discovers that Margaret's blood pressure had dropped to 95 over 55. Far too low. The medication that was supposed to protect her heart nearly took away her independence. Now, I wish I could tell you that Margaret's story is unusual, but it's not. Versions of this story play out in hospitals and homes across America every single day. A study published in the Journal of the American Medical Association found that overtreatment of blood pressure in elderly patients was associated with a significantly higher risk of serious falls, acute kidney injury, and dangerously low blood pressure episodes called hypotension. Another study in the British Medical Journal found that seniors over 75 who were aggressive aggressively treated to reach a systolic blood pressure below 120 had higher mortality rates than those maintained at a slightly higher number. Read that again. Higher mortality rates, meaning they were more likely to die. This is not fringe science. This is mainstream medical research being published in the most respected journals in the world, and yet the message hasn't reached most doctors' offices. The old habits persist. The prescription pads keep coming out, and seniors keep suffering unnecessarily. Alright, so now you're probably thinking, okay, I understand the problem, but what do I actually do about it? Great question. Let me give you a practical step-by-step plan. Number 1, know your numbers. Buy a reliable home blood pressure monitor. They cost between $20 and $50 at any pharmacy or online. Check your blood pressure at the same time every day. Sit quietly for 5 minutes before testing. Keep a log. Write down the numbers. Bring that log to every doctor's appointment. This is incredibly powerful because blood pressure readings in a doctor's office are often inaccurate. There's actually a well-documented phenomenon called white coat hypertension, where your blood pressure spikes simply because you're nervous about being at the doctor. Studies suggest that up to 30% of seniors diagnosed with high blood pressure may actually have normal readings at home. 30%. That means nearly 1 in 3 seniors may be taking medication they don't even need. Number 2, have an honest conversation with your doctor. I know this can feel intimidating, but you have every right to ask questions. Here are 3 questions I want you to bring to your next appointment. Question 1. Based on my age and overall health, what is the ideal blood pressure target specifically for me? Question 2. Are there any risks to lowering my blood pressure too aggressively at my age? Question 3. Could any of my current symptoms, like dizziness, fatigue, or confusion, be related to my blood pressure medication? Write these down. Take them with you. You deserve answers. Number 3. Never stop or change your medication without talking to your doctor first. I cannot stress this enough. Even if everything I've shared today makes you want to flush your pills down the toilet, please don't do that. Suddenly stopping blood pressure medication can cause a dangerous rebound spike that could lead to a stroke. Any changes to your medication need to be done gradually, under medical supervision. This video is about empowering you with knowledge so you can have a better conversation with your healthcare provider. It is not a replacement for medical advice. Number 4. Focus on natural blood pressure management. Regardless of what your target number is, there are simple, natural strategies that can help maintain healthy blood pressure at any age. Reduce sodium intake. And I don't just mean putting down the salt shaker. Most sodium in the American diet comes from processed and packaged foods, canned soups, deli meats, frozen dinners, restaurant meals. Start reading labels. Aim for less than 1,500 milligrams of sodium per day. Increase potassium-rich foods. Bananas, sweet potatoes, spinach, avocados, and beans are all excellent sources. Potassium helps counterbalance sodium and relax blood vessel walls. Stay physically active. You don't need to run marathons. A 30-minute walk 5 days a week has been shown to reduce systolic blood pressure by 5 to 8 points. That's as effective as some medications. Manage stress. Chronic stress keeps your blood pressure elevated around the clock. Deep breathing exercises, gentle yoga, prayer, meditation, spending time in nature. Find what works for you and make it a daily habit. Maintain a healthy weight. Even losing just 10 pounds can significantly lower your blood pressure. Limit alcohol. If you drink, keep it to 1 glass per day or less. Get quality sleep. Poor sleep, especially sleep apnea, is a major hidden cause of high blood pressure in seniors. If you snore heavily or wake up gasping, talk to your doctor about a sleep study. Now, I want to step back and share something important with you. The reason I make these videos is not to scare you. It's not to make you distrust your doctor. Most doctors are good, caring people who genuinely want to help their patients. The problem is systemic. Doctors are overworked, appointments are rushed, medical guidelines are complicated and sometimes contradictory, and the pharmaceutical industry spends billions of dollars every year promoting the idea that every health problem can be solved with a pill. But you are the expert on your own body. You know when something doesn't feel right. You know when a medication is making you feel worse instead of better. You know when you're being dismissed or rushed through an appointment. And you deserve a healthcare provider who listens to you, who treats you as an individual, who considers your age, your lifestyle, your goals, and your quality of life before writing another prescription. If your current doctor doesn't do that, it might be time to find one who does. Consider seeking out a geriatrician, a doctor who specializes specifically in the health of older adults. They understand the unique challenges and needs of aging bodies in a way that general practitioners often don't. Before we wrap up, I want to make sure you know the warning signs that your blood pressure might be too low from over-medication, because these symptoms are often mistakenly attributed to just getting older. Watch out for frequent dizziness or lightheadedness, especially when standing up, unexplained fatigue or feeling washed out even after a good night's sleep, blurry vision that comes and goes, difficulty concentrating or brain fog that wasn't there before starting medication, nausea or feeling faint after meals, frequent falls or loss of balance. And this is a big one. Feeling like you just aren't yourself anymore. Like your energy, your sharpness, your spark has faded. Many seniors describe this feeling and assume it's just aging. But in many cases, it's the medication. And when the dosage is properly adjusted, they feel like they've gotten years of their life back. That's not aging. That's over-treatment. And it's reversible. Let's bring it all together. Here's what I want you to remember from today's video. 120/80 is not the universal gold standard for every person on the planet. Your blood pressure target should be personalized based on your age, your health conditions, and your individual risk factors. For many seniors over 60, a systolic blood pressure between 130 and 150 may be perfectly safe and actually healthier than pushing below 120. Overtreating blood pressure in older adults can lead to dangerous side effects including falls, kidney damage, cognitive decline, and even increased risk of death. You have the right and the responsibility to be an active participant in your healthcare. Ask questions, monitor your numbers at home, and never be afraid to advocate for yourself. And above all else, never let anyone make you feel like your concerns don't matter. Your health matters. Your quality of life matters. You matter. I have seen too many seniors suffer in silence because they thought feeling terrible was just a normal part of getting older. It doesn't have to be that way. Sometimes the biggest improvement in your health comes not from adding another medication, but from questioning the ones you're already taking.
If this video helped you today, I want you to do 3 things for me. First, hit that like button. It takes 1 second, but it helps this video reach more seniors who desperately need this information. Second, subscribe to this channel and tap that bell icon so you never miss a new video. Every week, I bring you honest, easy to understand health information designed specifically for adults over 60. And third, leave me a comment below. Tell me, have you ever experienced side effects from blood pressure medication? Has your doctor ever discussed what the right target is for your age? I read every single comment and I would love to hear your story. And please, share this video with someone you love. Text it to your spouse. Send it to your adult children. Share it with your friends at church or in your community group. Because the truth about blood pressure for seniors is something that every family in America needs to understand. Thank you so much for watching. Take care of yourselves, my friends. I'll see you in the next one.